are here in Valencia, Spain, at the 5th World Congress on Sleep Medicine, and I have with me Dr. Diego Borreguero, who is a neurologist and sleep expert from University of Madrid, and he's also the chair of the International LS Study Group. And in fact, Dr. Borreguero will introduce us in this program that underline what has been discussed and presented at this Congress around RLS and related topics.
Yeah, sure. The International Restless Sleep Study Group has a meeting of experts every year, and during that meeting we try to review where we are in terms of clinical knowledge and the knowledge of the pathophysiology of RLS. And also we try to focus on a particular aspect of RLS. We do these meetings not every second year together with the World Congress of Sleep Medicine, and this time this is being in Valencia. What we are trying to assess is what new knowledge we have in terms of diagnosis of RLS, of treatment of RLS, and in terms of animal models of RLS. The animal models have been the particular focus of this meeting because we feel that in order to understand the disorder properly, we need to have models on which we can test hypotheses and test treatments. Only if we have a proper animal model, we are going to be able to develop treatments that are effective on the long term.
Thank you. And where you see now the knowledge about the RLS stands? What do you think has been the major achievement in the last few years?
Well, on the one hand, we know that dopaminergic mechanisms play a role in RLS, but we are finding out that other neurotransmitter dysfunctions are also involved in the disorder. So adenosine and glutamate dysfunctions seem to be playing a role, also opiates seem to be playing a role, and this is becoming more and more. Why is this important? Because this is becoming the target of new emerging treatments. This is one of the points, and this is being tested in animal models these days. The other thing is that we are understanding more and more about the genetics of the disorder, but we don't know, a number of genes have been shown to be involved in RLS. Whether we know that what these genes specifically do in terms of creating a dysfunction that leads to RLS, there's a knowledge gap. There we have to do more research. We don't know exactly what these genes are doing, but we know that some of the genes are involved in the iron disturbance that leads to RLS, for example. The other area that is going to be discussed quite much in this meeting is long-term treatment with new treatment. Specifically, there will be a symposium on opiates and RLS, and also the long-term consequences of not treating RLS. Until recently, we thought that RLS was a problem of quality of life. I mean, having RLS, we thought that a patient with RLS was a patient that could sleep badly, could function badly during the day, but it was mainly a problem of quality of life. What we are starting to find out is that it's not just a problem of quality of life, but also of quantity of life, and that puts the entire disorder in a different dimension. Because new data are emerging showing an increased cardiovascular risk. In certain types of RLS, there has been shown that there is an increased mortality. There's an increased risk of diabetes, at the same time of hypertension. And the first data showing that if RLS is being treated, this risk can be reduced are going to be shown in this Congress.